No, I have the clear step brace and I'm wearing it at the moment, and you can't see it, it's completely clear.
No, I don't think so. It's usually me that tells them, look at my brace. They don't really notice it, no.
Well, I've currently had my fixed brace on for 18 months and no one particularly notices.
There's a range of prices, obviously. It's according to which brace you choose. We do offer 0% finance, so you can spread the cost of the treatment up to 18 months. No interest, so a lot of patients find this very affordable.
Oh no, you're not too old to have braces. We range from children right the way through to, well, our eldest patient was 70 when she started.
For a simple treatment, for a treatment of a milder problem, it could be as little as 6 to 9 months.
Something a bit more complicated might take more like 2 years or even 2.5 years. But obviously, you know, everyone's a little bit of a spectrum, so there'll be some people who it'll be quicker than others.
They do feel different a little. As you go through the steps with the brace, you can feel very subtle changes in your teeth, but it's very, very gradual and very slight.
Not straight away, but over about a couple of months it was massive improvement.
Yes, yeah, very quickly.
It depends on the severity of the crowding. Some people notice it quite soon after the fixed brace has been put on, and other people obviously have to wait a bit longer to see a difference.
We of course try and avoid it where possible. For most mild to moderate problems, yes, it can be avoided.
We still have to take teeth out for some patients, and it's something that we like to try and avoid if possible, but there are some situations where it has to be done.
If there is severe crowding or a correction of a bite problem, then we do have to consider that in order to achieve the best possible result for you.
So it depends on kind of what your feeling is about braces.
But nowadays we have crystal clear braces which are hardly noticeable at all. People are often pleasantly surprised that they don't get any remarks from their friends or colleagues. And you may have heard of completely invisible braces now, which can be fixed behind the teeth, completely out of sight.
So if you're particularly conscious of the brace showing, that's an alternative that some patients go for. That's very popular at the moment.
And this actually fits behind the teeth, so it's just not visible to anyone when you're wearing it. Okay, we can offer invisible aligners, which actually fit over the patient's teeth. They just nudge the teeth into a new position. They're given a box of these aligners which they change at home, and then once they finish that box they come back into the surgery and new impressions are taken for a further box if needed.
We know that the teeth can try to move again after the treatment, so we always recommend retainers after someone's had their teeth straightened. At the very minimum, this involves having a simple clear retainer worn at night times. In some cases we use a wire retainer just glued behind the front teeth as well.
No, overall the treatment's not painful.
Having a brace fitted is completely pain-free. We find that patients usually notice a little bit of discomfort for a few days afterwards, but then they'll get used to it quite quickly and very pleasantly surprised that it feels fine after that.
Yeah, after a while it's like wearing glasses or earrings, you get used to it.
We try and get you in as soon as possible after you make your first contact. Usually we like to do that within 2 or 3 weeks because we understand that you've come to us because you have a drive to have something done, so we want to be acting on that for you as soon as possible.
There's a few steps to go through first in terms of taking some x-rays and photos and moulds of the teeth, but usually we can get going within a matter of a few weeks.
And to actually physically start the treatment, we try and do that within about 6 to 8 weeks.